Hi everyone, this is Nurse Anna from nursestudy.net, and today we're going to be doing a lecture for jaundice in both adults and infants. I'm going to have to switch over to the robot voice for the rest of this lecture, maybe up until the ending, because for some reason my mic is getting very staticky. So I have a new one on order, but I did want to get this lecture out. So thank you for your patience, and let's get on with the lecture.
The hepatobiliary system is composed of the liver, gallbladder and the corresponding bile ducts. The primary function of this system is the production of bile, a type of digestive enzyme utilized in the digestion of fat. Jaundice is a medical condition where there is an excess of bile in the circulatory system, producing unwanted effects such as yellowing of the eyes or icteric sclera. Patients of all ages can develop jaundice and causes will depend on various factors. Adult jaundice. Fever, chills, flu-like symptoms, if it is caused by an infection. Abdominal pain, when usually caused by cancers. Changes in skin color and sclera, i.e. yellowish in color. Dark-colored urine and or clay-colored stool. Skin itchiness, infant jaundice. Physiological jaundice, yellowing of the skin and the sclera, usually appears between the 2nd and 4th day after birth. This is usually due to the infant's immature liver. Pathologic jaundice, yellowing of the skin that occurs within 24 hours from birth. Other signs of pathologic jaundice are: skin turns more yellow, difficult to awaken, changes in sensorium, poor feeding. Causes of adult jaundice: before bilirubin production, unconjugated jaundice, reabsorption of a large hematoma or a clotted blood under the skin. Hemolytic anemia causes adult jaundice during bilirubin production. Viruses, such as hepatitis B infection, alcohol abuse, autoimmune disorders, rare genetic metabolic defects, medications, such as acetaminophen or Tylenol toxicity. Causes of adult jaundice, after bilirubin production, usually due to blockage. Gallstones. Swelling of the gallbladder. Gallbladder cancer. Pancreatic tumor. Causes of infant jaundice physiology. Newborns produce bilirubin faster compared to adults. The breakdown of red blood cells is also quicker in newborns. Because of the immaturity of their liver, excess bilirubin spills into the bloodstream, causing the classic signs of jaundice. Causes of infant jaundice, pathology. Jaundice observed within 24 hours from birth signifies a pathologic origin and may be due to hemorrhage, infant sepsis, A, B, O or Rh incompatibility between the mother and infant, liver abnormalities or malfunction, such as biliary atresia, enzyme deficiency, abnormalities in the infant's red blood cells. Key risk factors of neonatal jaundice are: prematurity, significant bruising during birth, difference in the blood type of the neonate and the mother, difficulties of the neonate to breastfeed, East Asian ancestry. Complications of adult jaundice: constipation and or diarrhea, stomach pain, vomiting, bloatedness or feeling of fullness. Complications of infant jaundice: acute bilirubin encephalopathy. Bilirubin is toxic to the brain. When it crosses the blood-brain barrier, it will cause acute bilirubin encephalopathy as manifested by difficulty waking, high-pitched crying, fever, poor feeding. Complications of jaundice: kernicterus, a syndrome indicating permanent damage to the brain. This is characterized by athetoid cerebral palsy, characterized by involuntary and uncoordinated movements, permanent upward gaze, hearing loss, poor tooth enamel development. Diagnosis of jaundice: physical exam. This involves assessing for unusual bruising, abnormal collection of blood vessels under the skin, spider angiomas, red discoloration of the palms, palmar erythema, and palpation of the liver for signs of tenderness. Diagnosis of jaundice: laboratory studies. Urinalysis. Testing urine samples will allow for the assessment of conjugated jaundice. Complete blood count, CBC, to assess for signs of infections that may cause jaundice. Serum bilirubin levels, to assess for the baseline levels of bilirubin in the blood. Imaging studies. Ultrasonography, to assess for the size of the liver and its surrounding structures. CT scan, to assess for the presence of mass in the liver, gallbladder, and bile ducts. Liver biopsy, to confirm any suspicion of liver cancer. Transcutaneous bilirubinometer, includes a skin test that utilizes this device that measures the reflection of a special light through the skin. Treatment of adult jaundice. Surgery. If the cause of jaundice is blockage due to stones in the gallbladder, cholelithiasis, surgical removal of the stones or gallbladder will be done. Antibiotics and peritoneal dialysis. In instances where infection is the cause of jaundice, such as leptospirosis, antibiotics will be prescribed, and peritoneal dialysis will be done to correct the condition. Treatment of infant jaundice. Monitoring. For mild jaundice, the condition may subside within 2 to 3 weeks. Admission. For moderate to severe jaundice, a longer hospitalization stay will be warranted. The treatment options include enhanced nutrition, to supplement the nutritional needs of the infant. Light therapy, also known as phototherapy. Light therapy helps by changing the structure of the excess bilirubin in the patient's skin to allow for its excretion through the urine and stool. Intravenous immunoglobulin IVIG. In instances of A, B, O, and R, H. Incompatibility. Administration of IV Ig is beneficial to reduce the serum levels of the antibodies in the blood of the infant. Exchange transfusion. In rare cases wherein the above procedures are unsuccessful, the infant's blood is withdrawn repeatedly and replaced with a donor's blood to remove the excess bilirubin.
Now we're going to go ahead and look at some nursing care plans for jaundice. Nursing diagnosis would be hyperthermia related to infection and excessive bile in the blood, secondary to adult jaundice as evidenced by temperature of 39 degrees Celsius, rapid and shallow breathing, flushed skin, profuse sweating, and weak pulse. Our desired outcome would be within 4 hours of nursing interventions, the patient will have a stabilized temperature within the normal range. And some of your nursing instructors will probably want you to actually state that normal range. Intervention. Assess the patient's vital signs at least every 4 hours. Rationale. To assist in creating an accurate diagnosis and monitor effectiveness of medical treatment, particularly the antibiotics and fever-reducing drugs administered. Intervention. Remove excessive clothing, blankets, and linens. Adjust the room temperature. Rationale. To regulate the temperature of the environment and make it more comfortable for the patient. Intervention. Administer the prescribed antibiotic and antipyretic medications. Rationale. Use the antibiotic to treat bacterial infection, which is the underlying cause of the patient's jaundice and hyperthermia. Use a fever-reducing medication to stimulate the hypothalamus and normalize the body temperature. Intervention. Elevate the head of the bed. Rationale. Head elevation helps improve the expansion of the lungs, enabling the patient to breathe more effectively. Okay, everyone, that does it for our lecture on jaundice with our sample nursing care plans. We have a ton more nursing care plans on jaundice at nursestudy.net. We also have practice exams and study guides. The website is completely free to use. I hope you enjoy this lecture, and I will see you in a couple days.